Well, good morning, everyone, and thank you so much for that warm introduction. It truly is an honor and a pleasure to be here to speak to all of you this morning, and to all of you that are joining on Zoom. Good morning, and thank you for joining as well. I have to admit it was no small feat getting here, coming from Houston, where it's still a balmy 90 degrees. When I arrived yesterday and it was 75 and no humidity, I was like, I have essentially arrived in heaven. I almost forgot what it felt like to breathe without swimming through an atmosphere that was so thick. But I'm thrilled to be here. And as much as I would like to talk about the weather, I want to discuss something a little deeper today and talking about professionalism. And we sort of know what professionalism is. We sort of know what it feels like. We sort of know what it looks like. But as we move forward and start to engage in high stakes medical care, as we are all doing, it's what we've recognized is that it's important for us to be intentional when we talk about professionalism and how we want to move forward with it within healthcare. I don't have any disclosures to mention this morning. And so as healthcare continues to evolve, where safety and quality are so important, it's becoming increasingly clear that professionalism is not just an attribute. It's the cornerstone of building high reliability in organizations that consistently are seeking to deliver safe and effective care. And so what we'll talk about this morning is we'll try to understand how professionalism drives reliable and safe care within healthcare systems. And we're also going to connect professionalism, accountability, and well-being, and look at how this critical connection can work to directly impact patient safety. We're also going to examine how professionalism enhances the teamwork that we do, communication, and collaboration. And so we have to ask the question, why are we here today? Why are we having to talk about professionalism in this way? One of the leaders in our specialty, Dr. Chestnut, delivered the Rovenstein lecture almost 8 to 10 years ago in 2016. And he asked this very question during the delivery of that Rovenstein lecture. And he asked 3 questions that we have to consider back then. And I think it's still relevant that we're considering those 3 questions today. Why does professionalism continue to require our focus? Despite years of discussion, it still remains a critical issue. And he lends itself to saying because it's dynamic. Professionalism is one of these dynamic tenets that exists. It evolves. It evolves with changes in technology. It evolves with patient care models, and the ethical challenges that we continue to face change each and every day. And so and then he asked the question, why is it important in anesthesiology? And as anesthesiologists, we're technical experts, and we play this key role in our professional spaces where our judgment and collaboration are necessary as we converge and deliver patient care. It shapes our interactions with our colleagues, our patients, and with the broader healthcare environment. And then kind of asking the question again, why must we commit to this ongoing conversation? And professionalism is the bedrock of ethical and compassionate care. And his insights during that lecture serves as a constant reminder to us about the responsibilities that we are called to make sure that we are enduring as we are looking towards developing this commitment to high standards in care. His quote highlights, a quote from him highlights about the professionalism in anesthesiology and really in healthcare is not a fixed trait, but it requires ongoing commitment and growth. And I think as we look at it through this lens, and one of the things that we've tried to do is we've developing a culture of professionalism is looking at it as a continuous level of growth for everyone, where we've never really arrived at being the consummate professional or in professionalism, but that we are all equally on this journey and of being professional. And so it's a skill that evolves, and we have to recognize how where we are and as individuals and the level of accountability that we play in being professional within our workplaces. And so it's a both a commitment and a competency that challenges each individual to reflect on their interactions each and every day. And so as we kind of look again, going along on this theme and asking as to why we're here, I want to reference Jonathan Haidt's work as we examine some broader societal shifts. Jonathan Haidt, as many of you already have read his work and author of many books, his research focuses on the impact of social media on society. And being the mother of two boys, I've become very interested in that work because of the impact of social media on society. But in reading his work, he sort of highlights the trends that are contributing to some of the challenges that I would argue that we're dealing with today. He notes how shifts in how individuals and shifts interact inside and outside the workplace, with increased polarization as we see everywhere across our workplace environment, declining institutional trust from many members in healthcare, and also this rising individualism from people, as he describes it. That all has affected how we engage with each other on a personal level within the workplace, and also how we engage with our patients within the workplace. And so these shifts that he has described may in some way have eroded some of the norms of professionalism, making it critical to foster a culture that looks to uphold these values intentionally. And so as we kind of recognize these societal shifts and the impact on professionalism, at our institution, we started to try to determine how we can be intentional on ensuring that even the smallest workplace interactions that occur that are not just left up to chance, but in evaluating how we can develop and truly develop a culture. And we put out a survey. One of our surveys identified that there was a need for us to be intentional in developing a culture of professionalism, both within our division of anesthesiology and across the institution as a whole. And so that's how we as an institution at MD Anderson arrived at this place in being intentional about talking about professionalism and developing this culture of professionalism. And it's important to recognize the role of professionalism and how it interacts with high reliability organizations. And so we hear so much about what high reliability organizations are, and professionalism is sort of at the bedrock and the base of what it is to be considered a high reliability organization. As we look at studies that show between 200 and 400,000 patients suffer preventable harm each year, making medical errors the third leading cause of death in the United States, just behind heart disease and cancer. And so when we look at those significant risks, it's necessary to recognize that developing a high reliability organization and playing this significant part on effective communication within the work environment and ensuring that there is stability within our organizations is necessary. And so it's when talking about high reliability organizations, one of the most significant quotes that has resonated with me is that these are high risk environments that yet manage to stay relevant and to stay within the safety despite the hazardous environments in which they are in. And as a team that operates particularly in our operating room teams, it's important that as we lead, it's in staying within the tenets of being a high reliability organization, that we can continually try to reduce the risk of things that we have control over within our work environment. In healthcare, a culture of high reliability is built on daily practices where we prioritize our patients and safety that that we do. And we do that in many different ways. And when we look at in the perioperative space, it's critical that we emphasize the cultural and behavioral aspects that are important for delivering a high reliability organization. We understand already as leaders within the operating room space, we understand the key practices that we do. We prevent surgical site infections, we prevent improve airway management, and we reduce recovery time and mortality within the operating room. We all are trained to do that, and we understand how to follow those protocols in doing that. And so when we apply high reliability in perioperative space in terms of the technical elements, we understand that. Looking at how we can impact behaviors, that's where it's important for us to recognize where we can play a different role in the behaviors that occur within the perioperative space. And so we continue to talk about the monumental shifts that we undergo, and how important it is to have effective communication and teamwork that prevent errors. And that's really where the importance of the professionalism with coworkers is necessary, because we can link lapses in professionalism, and not just big lapses in professionalism. We can link minor lapses in professionalism from coworkers, and we can link that to lapses in patient safety. And so this slide sort of highlights the importance of professionalism for both patients and healthcare organizations. And this has been an issue, and been looking at this since the 1980s, which led to institutionalization of standards of focusing. And the shift today has focused on looking at the Swiss cheese model and identifying where there are different points at every level when lapses of professionalism can occur, to identify how it can impact and lead to significant increases in errors when those elements are undermined. And then when implementing change and ensuring the development of a culture of professionalism, we know that it can be really complex. And because of that, the dynamic nature of the culture, it's important to identify where are there different parts to work on ensuring that we're not engaging in unprofessional behavior. And everyone needs to be intentional about that. And so this slide sort of highlights the growing problem that we're seeing. According to a survey, 98% of clinicians have observed lapses in professionalism, with over 70% of physicians and healthcare workers witnessing it at least monthly. And so these behaviors, again, not only affect our communication and teamwork, which is critical, but also has a direct impact on patient care and safety. And so addressing these disruptive behaviors is really important and critical. Now, we know that the expectations that we are all required to do can truly be compared to balancing on a tightrope. And I mean, between constantly juggling the multiple factors that we have to do every single day, can lead to the stress, leads to the burnout, which are prevalent and can contribute to lapses in professionalism significantly. And so we know that we are all working, like some of the data points out to 50 to 75% of physicians, they're working under stressful environments. I would argue everyone is probably working under stressful environments. And not only that, everyone also has their personal lives and their personal stories that they bring to work with them. And that on top of the stressors at work contributes to, again, balancing on this tightrope and essentially falling off of it. But as we recognize the different points of where it's important for us to be intentional about developing this culture of professionalism, it becomes increasingly important, not only for our patients, but also for ourselves on an individual basis. It's the lapses in professionalism are the most common reason for disciplinary actions by state medical boards, whether it's coming from severe irresponsibility, unreliable working conditions and working relationships, resistance to self-improvement, or impaired relationships. These all lead to lapses that can ultimately not only impact our patients, but also impact our professional careers. And so this is why, another reason why it's important for us to be focused on it. Now, JCAHO is also something that's focused on professionalism. They started to focus on it in 2008, and they considered disruptive behavior to be threatening and inappropriate for developing a safety culture. And so for this reason, they started to consider it a sentinel event alert, indicating the importance of preventing, managing, and controlling these behaviors among healthcare professionals. And then effective in January of 2022, they implemented new workplace violence standards to provide a framework and guide for healthcare environments to define what it looks like to prevent the violence, and also to developing leadership structure, policies and procedures, and reporting systems, so that way these events can be reported, and not only reported, but addressed, and providing feedback for individuals that engage in these behaviors. This is a study that we did at our institution that will actually be published in a Journal of Patient Safety and Culture in the future. It hasn't been published yet, but we at our institution, we examine professionalism lapses and the increase during the COVID-19 pandemic. Before the pandemic, we saw maybe one monthly professionalism related event. During the pandemic, this rose to almost 5 monthly events due to workload pressure, emotional exhaustion, resource constraints, and communication breakdown. High patient volumes, limited staffing, all of these things contributed to lapses in professionalism. And so post-pandemic, as we moved to the endemic phase, these events decreased to about 3 per month. But the lingering pressures from the pandemic continue to challenge the professionalism within our environment. And this is an example of some of the most common themes that we identified during this time period. The types of behaviors that were combative, hostile, disruptive types of behaviors. And I apologize for this being a little small, but you can see some of the different comments that we saw, and were able to categorize either as a combative or hostile, disruptive environment, frank rudeness occurring within the perioperative space, inappropriate behavior, people being uncooperative and non-responsive in the operating room, and ultimately just some unsafe behaviors that might have seemed small, but yet were significant types of comments or inactivity that led to lapses in professionalism. And so what we found that the lapses in professionalism had a significant impact in turnover rates in our perioperative services. And so by the time during the pandemic, the turnover increased sharply to 9%, and eventually reaching its peak at 15.5%. So what we found in terms of the elements of stressors and increase in lapses in professionalism, ultimately leading to increase in staff turnover. And so this demonstrates how just minor lapses, or what can be perceived even as minor lapses in professionalism, has significant impact within the work environment. Now, as we look at the risk of complications in patients and surgeons and their unprofessional behavior, we have worked very closely with Vanderbilt in terms of developing our culture of professionalism. As Vanderbilt, they are the leaders in professionalism space, and they've been doing this for over 20 years. And as we have started to develop our culture of professionalism and our Center for Professionalism, we've adapted their model. Now, they did this study, and this looked at the significant correlation between a surgeon's unprofessional behavior and the increase in complications. And this data demonstrates that the number of coworker complaints about a surgeon's unprofessional behavior, as those rise, so does the likelihood of complications in their patients. And what it showed was that surgeons with 4 or more reports from coworker complaints, they had a complication rate of about 14% compared to 10% for those with no reports. These complications occurring with 30 days post-operative included issues such as surgical site infections, multiple complications in multiple medical comorbidities. And so this significantly linked unprofessional behavior with patient safety and with complications. Another study that addresses unprofessional behaviors and mistreatment of trainees, and when an online reporting system was implemented to help identify faculty members that were associated to unprofessional behaviors toward trainees. And this study showed the distribution of reports from faculty members and the increase in awareness and commitment to creating a safe learning environment by allowing reporting of these behaviors to occur in an anonymous way. Now, Vanderbilt also identifies they also have the patient advocacy reporting system. And the study that evaluated the impact of patient complaints, when patients complain about their physicians and their lapses in professionalism, identified a decrease in malpractice claims when those surgeons were addressed for their behaviors. And of the 42 high-risk clinicians, 90% showed improvement in their PAR scores and when their behaviors were reported and feedback was provided to those physicians. And so this also shows the significance of the importance of not only reporting on their lapses in professionalism, but providing early feedback. One of the things that Vanderbilt has shown is that when early feedback is provided, when there are even minor lapses in professionalism, 97% of individuals will self-correct their behaviors. Now, before receiving their first delivered feedback, the physicians and physician assistants who were part of this identified group, their malpractice claims were around $95,000 per claim. And that decreased significantly to around $16,000 after they received feedback and were able to determine where their behaviors were and how their behaviors were essentially impacting their patients. And so this study here from the Anesthesia Closed Claims Project database of almost 10,000 patients focused on 1,100 of the perioperative claims. Of these, around 575 involved communication failures, and 389 of those had injuries that were directly related to communication breakdown. And so this underscores the critical role of effective communication in ensuring patient safety and reducing adverse outcomes in anesthesia care. And so they found that communication failures contribute to overwhelming majority of these cases with multiple communications breakdown. Again, pointing to the element of where unprofessional behavior and how it impacts us. And so the studies that we have reviewed have shown that unprofessional behavior and communication breakdown directly impacts patient safety and quality care. Drug errors, hospital-acquired infections, and adverse drug reactions can also all occur because of disruptive behaviors. Provider imitation accounts for almost 7% of drug errors. And so as we look at these and look at these patient outcomes, it's important to recognize where those impacts are from the broader organizational perspective. It's also impacting behavior on an individual, leading to decreased productivity, decreased satisfaction between a physician and a patient, and the importance of lack of psychological safety that can occur. And so following our discussion in the impact of professional behavior, it's important for us to recognize that, again, these are intangible, often intangible, and difficult to sort of determine what is unprofessional behavior. We have what the Institute of Medicine, or the American Board of Medical Specialties, has just defined as professional behavior. And it's important that we hold on to these and identify these competencies as we're looking at when we're within our departments and within our teams, what do we want to be considered as our definition and what we want to hold as professionalism? Our words matter. When we look at all of our reports, these are some of the most common words that we identified when we look at all of our professionalism reports. And this word cloud, it highlights the most commonly behaviors that we've seen. And we can tell how this is a stark difference from what American Board of Medical Specialties want us to include as professional behaviors. Now, when we look at this continuum of incivility, it's important to recognize how low risk, unseemly behaviors, eye rolling, sarcastic comments, they seem low risk, but they're disruptive. And it's important to know, and Christine Parath, she talks about this in her book about workplace civility. But when we look at incivil behaviors, it's not just the egregious behaviors that we have to be concerned about. It's the small behaviors, the low risk behaviors. And because when we can start to provide feedback about those behaviors, we lend ourselves to improving the workplace culture. I'll play this video a little bit. So this is from Christine Parath, and she's the author of the book, Mastering Civility. And she talks a little, hopefully this works. She talks a little bit.
On people. What is incivility? It's disrespect or rudeness. It includes a lot of different behaviors, from mocking or belittling someone, to teasing people in ways that sting, to telling offensive jokes, to texting in meetings. So we launched a study on the effects of incivility on performance and the bottom line. And what we found was eye-opening. We sent a survey to business school alumni working in all different organizations. And we asked them to write a few sentences about one experience where they were treated rudely, disrespectfully, or insensitively, and to answer questions about how they reacted. One person told us about a boss that made insulting statements like, "That's kindergartner's work." And another tore up someone's work in front of the entire team. And what we found is that incivility made people less motivated. 66% cut back work efforts. 80% lost time worrying about what happened. And 12% left their job. Cisco read about these numbers and estimated conservatively incivility was costing them $12 million a year. But what about if you're not the one who experiences it? What if you just see or hear it? In another study in a small group, we tested the effects of a peer insulting a group member. Now, what we found was really interesting because witnesses' performance decreased too, and not just marginally, quite significantly. Incivility is a bug. It's contagious, and we become carriers of it just by being around it. So if incivility has such a huge cost, Why do we still see so much of it?
So I play this segment because I think it's important to recognize that the low-level incivility behaviors that we know can eventually progress to severe unprofessional behaviors don't only impact the person that receives it, but it also impacts the person or the people that witness it. And that's so important to recognize within our work environments, and particularly as we're looking to develop our
I
teams.
see the effects of incivility.
Let's move forward. Okay, great. And so this brings us back to, emphasizing the ongoing journey about professionalism. And one of the things that we had to reckon with when we were developing this culture of professionalism was that we were being punitive, that we were giving people feedback when reports of professionalism were provided, and then feedback was sent to individuals. It was initially thought as being punitive. But as we had to develop this culture of accountability and receiving feedback, we had to continue to highlight the journey of professionalism, and that the tiny moments that matter within our work environment are so important. It begins in training. It begins learning about how to be professional, begins in training when working with role models and working with attendings. And then it grows with us it grows with you as we go through our careers, and even into practicing, it continues to grow with us. And what we have to work to develop, I know many of you probably heard of this term of psychological safety, and developing this psychological safety where a belief that you and others will not be punished or humiliated for speaking up with ideas, questions, concerns, or mistakes. And so Amy Edmondson has been the person that has coined this term. In her book, In the Fearless Organization, she explores how a culture of psychological safety is important and is critical for developing that communication and learning and innovation that we are hoping to develop within our healthcare environments. And it's not just about being nice. It's not just about that there's no conflict, and because we know that conflict will occur, and there is healthy conflict. And as we embrace that, it becomes safe for everyone to take these interpersonal risks that we have to do. And healthcare organizations have to look to cultivate this culture where it's okay to raise concerns, have different points of view, and actively engage in environments with their colleagues. And so when there's different scales of where you want to be when we're looking at psychological safety, and it helps everyone when psychological safety exists, it's easier to collaborate with others. It's easier for us to consistently speak up and, again, engage in healthy conflict in a way that is not antagonistic towards the person, but focusing on trying to develop the ideas. And when we look at driving a culture of professionalism and where the value add is on that, we have to recognize that as we continue to move forward and continue to identify the challenges that we're going to continue to face in the work environment, implementing comprehensive education on professional behaviors becomes significantly important. And as we talk about, what matters when developing these cultures of professionalism, the core of everything we do when working in our team dynamics, every interaction focuses around building that trust. And so we talked about the ROI on developing a culture of professionalism because it improves culture and team engagement. It improves, ultimately, employee well-being, reduction in malpractice claims, and the quality and safety outcomes that are necessary. As we talk about identifying concerning behaviors, providing when those concerning behaviors are identified, the first notion is to talk about them and not provide feedback to that person. That doesn't help us get anywhere. As soon as it's starting to be provided as feedback, there's credibility when we can provide that feedback early on to ensure that those individuals can be aware of their behaviors. And then when we start to provide the feedback, it's important that we monitor individuals that are at risk and then intervene when necessary. And it's important to recognize that empathy has to be a part of this feedback process. This is an example that we had of one of our faculty members that we had to provide feedback for. And when providing that feedback in an empathetic way, we were able to identify what were some of the challenges that individual was facing from a wellness standpoint, because we know that wellness and lapses in professionalism are intimately linked. As wellness is decreased and as the well-being of our faculty members and our trainees are decreased, the incidences of lapses in professionalism increase. And so we've had faculty members where we've been able to help identify, because there have been lapses in professionalism, because they've been engaged in talking about their behaviors, some of the issues that they may have been dealing with personally have come up in these conversations. And then now we're able to provide support for that individual. And so as we look to promote this element of psychological safety, and as we look to promote wellness within our teams, it's important that the correlation with providing feedback and accountability is important. And so we've chosen this multi-pronged approach in terms of how we are developing this culture of professionalism through education on best practices in professionalism, because we're talking about lapses in professionalism, but we know that best practices in handling difficult patients are in handling difficult conversations with coworkers. We know that best practices in those are occurring every day. And so one of the things that we've also done is we've developed an award for professional excellence, where a physician can be nominated to receive the award for professional excellence from the institution. And anyone can nominate a physician. And so that way we recognize individuals who are demonstrating best practices, to recognize that behavior, but also to serve as an awareness of what professionalism looks like for others to emulate. And then again, we have trained peer messengers, and we also have division professionalism ambassadors. So at our institution, divisions are ahead of departments. And so we have division professionalism ambassadors who serve as the liaison between each division and the Center for Professionalism, because these individuals, they know the stressors that are occurring within their divisions. And they also have connections and relationships with the individuals within their divisions. And so having that lead person as a representative from their division in terms of providing the feedback, and also in terms of helping us to be at the center to become aware of some of the local concerns, is helping to drive that culture of professionalism that we're looking to develop at the institution. Again, we've used the reporting, tracking and benchmarking, and through an evidence-based approach to identify when individuals are receiving multiple lapses in professionalism and how that is impacting their workplace environment, and also so that individuals can see how they compare to other faculty members within our institution on their lapses in professionalism. And then again, one of the other things that we do is educate. We educate our faculty members on lapses, on professionalism, and that's part of acknowledging the fact that the journey of professionalism for each of our individuals. And so this is part of, this works for us at our institution because we have so many wonderful leaders within our institution that has been able to be a part of developing this culture of professionalism. We knew that it was going to be more than just policies and programs. It really needed to be an element where we had active engagement and leadership support across all levels in terms of developing this culture of professionalism. We started with institutional pop-ups where we would go to different parts of the organization and host educational pop-ups about the Center for Professionalism, about this being a non-punitive effort, and about the educational events that we were hosting. We were very fortunate to have significant leaders across the authors that have, and thought leaders that have many different approaches to managing difficult conversations. And this all helped us to develop this culture that we were looking to change and to make more impactful. And so it truly took a lot of stakeholders that recognized the value in doing so. So as I close, we talk about the decline in physician wellness among healthcare professionals and, the fragmenting teamwork that sometimes can occur that, directly impacts our patient outcomes. We have to be intentional in having conversations about lapses in professionalism and ensuring that we can collectively, as a culture, uphold the oath that we started with, to do no harm and to serve as the best advocates for our patients. So thank you for your time. I appreciate it.
We have some time for questions. I have a mic and I will travel.
Yeah, Crystal, thank you for a great presentation on an important topic. We exist in an environment in an academic institution which is very hierarchical in many ways. What does someone do when they're either the victim or they're witnessing unprofessional behavior from someone who is much more high-ranking than they are?
That's an excellent question. And that is where the element of anonymous reporting is helpful. And what we have is anyone can report. You don't have to be the person that has received it, but a witness can report on any individual that is demonstrating lapses in professionalism. I think it's through the anonymous reporting process that allows individuals to feel safe in reporting and knowing that that feedback will get to that person.
Dr. Wright, thank you. This is such an important topic. I guess my question has to do with when you're in situations with working with different team members, and as anesthesiologists, we work with a number of different surgical colleagues, but if another group's view of what professional behavior looks like is very different, and there's not a unified view of what professional behavior looks like, how do you create a sort of joint view across the organization? Because I think sometimes within our different teams, what we value or what is valued may look very different across teams. And I think that can create a lot of conflict.
Yeah, no, absolutely. And that is so prevalent. And that's why it's very difficult to get really to get to a definition of what professionalism is. We all, we know the tenets of what goes into it. Dr. Gerald Hickson at Vanderbilt, I think, had the best quote about what professionalism is, or what lapses in professionalism is. If I say something and if I do something that prevents you from showing up at work and doing your best work, that's a lapse in professionalism. It's because I've impacted how you can behave within the work environment. And I think when we can take that lens and look at what we think and how we approach that behavior, it really helps us to develop a dialogue right, around what lapses in professionalism is.
I love that. One thing that's hard is in the culture of medicine, we've created a sort of a cult of the individual around, especially in surgery, the surgeon as this head of the team, sort of de facto, which I think is hopefully changing. But how do we keep that model of responsibility to how your team is functioning, as opposed to having, this is all about how I function my best, and your job is to make me function the best.
Yeah, no, and I think and again, it goes back to it being a dialogue, because yes, we're here to help you function as best as possible, but we're also here so that we can function as best as possible. And that's where that psychological safety piece comes in. And if we have that psychological safety, then we can start to bring individuals together.
Hi, Dr. Wright. Thanks for being here. I am curious about your reporting systems, because what I feel, even as a resident, is specific circumstances I've been in, if I were to report even through anonymous reporting, like the person would know it was me. And so I'm curious if you guys have safeguards or certain like aspects of that reporting system, like for protections for people who want to report.
Right. So, and we get this question a lot, because it is difficult for individuals, especially if there is a power dynamic. It's difficult to feel comfortable, and similar to this question before, it's difficult to feel comfort in reporting. But part of that also has to be what the reporting is necessary. The anonymous reporting is necessary, and we do that. But as we develop this culture what we're doing it within the institution and even within our division, on the back end, it also has to be that you're not in trouble because you got reported, right? You've gotten one report on, and of course, now let me be clear, any egregious behaviors, on reports that we get, part of the professionalism pyramid is sending egregious behaviors. Those go directly to HR. But when we're talking about conflicts that we can manage, it's developing that culture first. When you are providing a lapse in, when a report on a lapse in professionalism has occurred and you're giving feedback, it's feedback. And it's an opportunity for you to become self-aware about it. And now if you're getting multiple reports on same types of behaviors from the same individual, then after several reports, this is no longer feedback. At that point, actions have to be taken. And actions can be, is there something that we need to help you with, right? Are there, systems issues that are preventing you from showing up and being your best self at work? What is it that needs to be addressed? And when we get to that level, that's when actions have to be taken.
There are a few questions online.
Okay.
So the first one, thank you for this presentation. This is Alyssa Burkhardt. Okay. How is your group addressing increasingly divisive and intense political beliefs in the workplace, especially this election season?
Yes. It's providing that feedback on, no one is trying to tell everyone what they should believe and how they should believe it, but there's a way to have civil discourse. And when we receive those types of reports, that feedback that is provided is about the importance of having civil discourse within the work environment.
Another question, and this is interesting because I feel like it comes up a lot when in the setting of feedback, that is, how do you avoid weaponization of professionalism reporting systems and its contribution to further burnout or lack of psychological safety?
Yes. So that is one of the areas that we have to pay very close attention to. And sometimes it's easy to pick up. Sometimes we can pick up when there is potential, weaponization of the system. And we go back to that person that is weaponizing the reporting system, and we provide feedback to them that weaponization of the reporting system is not tolerated, because that does diminish the integrity of the reporting system.
Do you have feedback training? Do you provide feedback, meaning training in how to give feedback?
Yes, we do.
Okay.
So our messengers that deliver the feedback are trained through the Vanderbilt model of delivering feedback. And we also provide continuing and ongoing education for our messengers we have messenger connections for all of our messengers where we meet monthly, and we have continuing dialogue with them about their experiences for delivering feedback, and also some education on appropriateness and ways to deliver that feedback.
Perfect. Thank you. This is an important topic in OR teams. One challenge of anonymous reporting is the frequency of poorly substantiated claims or disagreements perceived as unprofessional behavior. How do professional affairs committees avoid the trap of feeling obliged to presume guilt until proven innocent? How can professional affairs avoid creating a police state? Holy cow, that's
Yeah. Well, I mean, I think as you develop it, and that's part of why it's like developing a culture, just because we can talk about it, similar to how they developed a culture of patient safety, right? Everyone had to be comfortable talking about medical errors in order for us to get to developing this culture of patient safety. And I think that's the same for developing a culture of professionalism. We have to get comfortable about talking about feedback, accountability, and awareness. And once we're comfortable about having dialogue around that, then it becomes less police and more, this is just what we do.
Thank you. That was wonderful. Thank you so much, Dr. Wright, for
Thank
coming.
you all for having me. It was truly an honor to be here. Thank you.